We developed this clinic with the idea that it will be one-stop, basically shop for a patient with a musculoskeletal injury. We have orthopedic care and treatment. From the sprained ankle, a patient can come in, can get an x-ray. If he has to have a cast, he'll have a cast on. If he has to have an MRI, we have an MRI that we can do on him. If he has to have a minor procedure, minor surgical procedure that can be done here, can be done in one of our treatment rooms specifically designed for that. Almost we have microsurgical devices here. So we can do some minor stuff in here. The orthopedic surgeons here are geared to both conservative care, which is care that's non-surgical, as well as surgical care. We have, in the surgical department, we have two physicians, Dr. Emil Wakim and Dr. Ahern, and they do surgery. One of them is spine surgery, Dr. Ahern, as well as general, and Emil does the arthroscopies on extremities, knees, hips, shoulders, ankles, elbows, wrists, whatever. And then the conservative treatment, I deliver that in addition to the other doctors, and Dr. Kelsey Peterson does that too. Now, we have also neurologists that evaluate, like if you have a carpal tunnel or if you have a cervical disc. We have a neurologist, Dr. Mike Credier, who evaluates patients here and can, if he needs to, do what is called nerve conduction study. That means a nerve study to see where the deficit is, where the entrapment is in the nerve. So that's on those two. From the other point of view, if we need to have a psychologist evaluate the patient, and now this is something mandated before spine surgery, we have a psychologist here, Dr. Bone, who evaluates this patient pre-surgery, and if there's some stress-related activity due to job loss associated with the injury, they see him too. So from that point of view, we're covered from that area. If we need pain management, we deliver it here also through injections into the areas, into the nerve or facets that may help them. Now, and the other components that we have that are helpful is physical therapy. On the first floor, we have physical therapy department that takes care of the patients from A to Z in rehab, whether it's surgical, non-surgical, physical therapy for new injuries, for chronic pain, for back pain, spine pain. And in addition to that, if we need a chiropractor, we have a very fine chiropractor here that is an adjunct to what we're doing. Downstairs, also on the first floor, in the rehab department, we have an acupuncturist that provides acupuncture care to patients. So in all of that, we have for an injured patient, musculoskeletal disease or injury or whatever the case may be, it is pretty much one-stop shop in that regards.